Patients will often ask why we do not take x-rays in our office. Here's the answer. The current clinical guidelines for spine pain do not recommend taking imaging on the first visit in the absence of any red flags. Now, red flags are anything concerning that we find in our history or examination. If we hear a red flag, that could warrant the use of imaging, but in the majority of patients, the vast majority of patients that we see, we do not come across any red flags in the history or exam, regardless of how severe the pain is. And one of the reasons why we do not rely on imaging, especially on that first visit, is most cases of spine pain are not due to something structural in nature. They're not due to something that you can see on an X-ray or MRI. They are due to functional causes, movement-related causes. Now, if we go taking an X-ray on every single person that walks into our office, we are by default gonna see different structural things going on within the spine. Now, these structural issues may not have any clinical significance whatsoever. So if we see something on X-ray on the first visit, it is too easy to blame our pain on that issue. In fact, it has been found that asymptomatic arthritis, asymptomatic bulging discs are extremely common in the general population. So we cannot rely on these imaging findings alone. We are fortunate enough in the city of Charlotte to be surrounded by a number of great imaging centers. So in those few cases where we do have patients that do need an X-ray or they do need an MRI, we can get them those images easily. But fortunately, for the majority of our patients that are coming through our doors, we do not need to rely on imaging to effectively treat their spine pain. So if you are having spine pain or musculoskeletal pain of any sort, we would be happy to help you out. Please visit us online at TruMotionTherapy.com to learn more or to schedule an appointment.